Globally, most deaths in children aged up to 5 years occur in developing countries and are from preventable or treatable causes, such as diarrhea, pneumonia, malaria, and malnutrition. Preventing death due to these health problems is based on quality healthcare services at the health center and community levels through primary healthcare. Successful implementation of primary healthcare requires evidence. Evidence from health economic studies is an important part of inputs for policy development. I am Dr. Arthur Liu Phaiboon from the Division of Social and Administrative Pharmacy, Department of Pharmacy, Faculty of Pharmacy, Mahidol University. I am going to talk about two publications. They are from a thesis of Master of Science program in Social, Economics, and Administrative Pharmacy of Mr. Fulgence Deep Tibejika, who received a scholarship from the Thailand International Postgraduate Program. We work with another two co-advisors, Dr. Sithaporn Changkhong and Dr. Samsit Sangrungrungsi. The study was conducted in Burundi, Africa, where diarrhea remains the third rank among the leading killer in children aged under 5 years. To provide timely treatment of diarrhea, Burundi had adopted a pilot community case management program. The program seeks to provide as early as possible by community health workers since the onset of the episode. The treatment of diarrhea using oral rehydration solution and zinc to mild and moderate diarrhea patients. The effectiveness of the program has been proven. Diarrhea-related dehydration, hospitalization, and death rate were significantly reduced in the communities where the program was promoted. However, there is a lack of evidence on the cost effectiveness of the program to promote an expansion of the program. The studies were composed of two pieces of research. The first research is the economic burden of childhood diarrhea in Burundi. It was published in the Global Health Research and Policy Journal in 2021. In this study, we estimated the cost of diarrhea from a social perspective that covers the cost of health facilities and patients' families, both direct and indirect costs. The average total cost per episode of diarrhea was $109 international dollars. The study provided results on the importance of the economic aspect of the illness and was used in the following study on the cost effectiveness of the program. Another research is titled Cost Effectiveness Analysis of Community Case Management of Childhood Diarrhea in Burundi, published in the Journal of Review in original issue in 2021. Markov modeling approach was undertaken to assess the program of community case management of diarrhea from both provider and social perspectives. We found that when compared with the routine treatment at health facilities over 5 years, the program would avoid both morbidity and mortality equal to 2,749 disability adjusted life year or DALYs. In addition, the program creates cost savings by $1,056,699 and $2,328,531 from the provider and social perspectives, respectively. The program remains dominant with the probability of 100% within 10,000 simulations during probabilistic sensitivity analysis. In conclusion, providing the community case management program for diarrhea treatment is an attractive cost-effective intervention. Evidence from this study should be used to scale up the coverage of this life-saving and cost-saving intervention for Burundi. In addition, these findings may be generalized to other African countries. If you are interested in this research, you can scan QR code or send a request to my email.